We have three agents that we're using as the secondary agents. Aspirin needs to be started in all patients and continued indefinitely, and should not be stopped unless there's an allergy or other complication from it. But the other agents, in terms of clopidogrel, ticagrelor, and prasugrel, clopidogrel was historically the first agent we used. And interesting, in the American guidelines, the American Heart Association, American College of Cardiology guidelines, they're actually weighted the same way in terms of you can interchange, provided that a patient received a drug-eluting stent. Of course, if we have a patient that has NSTEMI or unstable angina, then, and they're going to be medically managed, which means they do not receive a stent, they should only receive either ticagrelor or clopidogrel for the 12 months as their secondary agent. But in patients that are actually stented, the Europeans actually recommend ticagrelor or prasugrel, and only reserving clopidogrel in patients that have had complications from the other agents or cannot get clopidogrel for some reason. This came about from a couple of trials. Ticagrelor was shown to have superiority data over clopidogrel in the Plato trial in terms of the primary endpoint of cardiovascular death, MI, and stroke. Interestingly enough, there was actually a secondary outcome in the trial that actually showed an improvement in all-cause mortality, and this was compared to clopidogrel. So in most cases, when we look in situations of affordability, as long as the patient's insurance would pay for it, similar to what the European Society of Cardiology guidelines would say, I would recommend to choose ticagrelor over clopidogrel. Similarly, prasugrel in the Triton-TIMI 38 trial actually was shown to perform better than clopidogrel in terms of the primary endpoint of stroke, MI, and cardiovascular death. So again, this is primarily the reason why in the European Society of Cardiology guidelines they do recommend these agents over clopidogrel. However, in our guidelines, they're still all weighted evenly.